Tuberculosis, or TB as it's often called, is one of the oldest known human diseases that, believe it or not, is still very much with us today. Tuberculosis is a bacterial infection that primarily affects the lungs, but can actually impact almost any part of the body. It's caused by a bacterium called Mycobacterium tuberculosis, which is a sneaky little organism that can hang out in your body for years without causing any trouble. But when it decides to wake up and get active, it can cause some serious health issues. Think of TB as the ultimate slow burner. It's not like a cold or flu that hits you fast and hard. Instead, it's more like a stealthy invader that sets up camp in your body and waits for the right moment to strike. This ability to lie dormant is one of the reasons TB has been such a persistent problem throughout human history. So, how common is tuberculosis? You might think of it as a disease of the past, something you read about in old novels or see in period dramas. But the reality is that TB is still a major global health issue. According to the World Health Organization, about a quarter of the world's population is infected with TB bacteria. That's right, we're talking billions of people. However, it's important to note that not all of these people have active TB disease. Many have what's called latent TB infection, where the bacteria are present but not causing any symptoms or problems. In terms of active TB cases, we're looking at about 10 million new cases each year worldwide. It's one of the top 10 causes of death globally, and the leading cause of death from a single infectious disease, ranking above HIV and AIDS. The prevalence varies widely between countries, with the highest rates typically found in developing nations in Africa and Asia. Causes of tuberculosis. As we mentioned earlier, it's all down to that bacterium, Mycobacterium tuberculosis. These bacteria spread through the air when someone with active TB in their lungs coughs, sneezes, speaks, or even sings. The bacteria can hang out in the air for several hours, especially in enclosed spaces with poor ventilation. If you breathe in these bacteria, you can become infected. But here's the thing, not everyone who gets infected with TB bacteria becomes sick. This is where we get into the difference between latent TB infection and active TB disease. When you first inhale the bacteria, your immune system usually steps up to the plate and walls off the bacteria, preventing them from spreading and making you sick. This is latent TB infection. You're infected, but not ill, and you can't spread TB to others. However, if your immune system can't contain the bacteria, or if it weakens later on, the bacteria can break out of their walled-off areas and start multiplying. This is when you develop active TB disease and can potentially spread it to others. Several factors can increase your risk of developing active TB disease. These include having a weakened immune system due to conditions like HIV, diabetes, or certain medications, being in close contact with someone who has active TB, living or working in areas where TB is common, like some healthcare facilities, homeless shelters, or prisons, or having certain other health conditions that make it harder for your body to fight infections. Symptoms of tuberculosis. The symptoms of active TB disease can vary depending on which part of your body is affected, but since TB most commonly affects the lungs, we'll focus on pulmonary TB. The most common symptom of pulmonary TB is a persistent cough that lasts for more than 3 weeks. This isn't just a tickle in your throat. We're talking about a serious, sometimes painful cough that just won't go away. The cough often brings up phlegm, which might have blood in it, a condition called hemoptysis. Along with the cough, you might experience chest pain when you breathe or cough. This pain can be sharp or dull and might make you feel short of breath. You might also find yourself feeling unusually tired all the time, like you just can't seem to shake off the fatigue no matter how much you rest. Weight loss is another common symptom of TB. You might notice your clothes getting looser even though you're not trying to lose weight. This often goes hand in hand with a loss of appetite. Food just doesn't seem appealing anymore. Fever is also a hallmark of TB, but it's not usually a high, burning fever like you might get with the flu. Instead, it's often a low-grade fever that comes and goes, making you feel alternately hot and cold. You might find yourself sweating at night, sometimes so much that you wake up with damp sheets. Other symptoms can include weakness, chills, and in some cases, swollen lymph nodes. If TB spreads to other parts of your body, you might experience additional symptoms depending on which organs are affected. For instance, TB in the kidneys might cause blood in the urine. TB in the spine can lead to back pain and stiffness, and TB in the brain can cause headaches, confusion, and even seizures. It's worth noting that these symptoms can come on gradually. You might not even realize how sick you are at first because the changes happen so slowly. This is another reason why TB can be so dangerous. By the time you realize something is seriously wrong, the disease might be quite advanced. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of tuberculosis. If a doctor suspects you might have TB based on your symptoms and risk factors, they'll typically start with a tuberculin skin test or a TB blood test. The skin test involves injecting a small amount of fluid called tuberculin into the skin on your lower arm. After 48 to 72 hours, a healthcare professional will check to see if there's a reaction. If there is, it could indicate that you have TB bacteria in your body. The TB blood test, also known as an interferon gamma release assay, measures how your immune system reacts to TB bacteria. It's often used instead of the skin test for people who have received the BCG vaccine, which is a tuberculosis vaccine commonly given in many countries outside the United States. However, these tests can't distinguish between latent TB infection and active TB disease. They also can't tell you where the infection is located in your body. So if these tests come back positive, you'll need further testing. The next step is usually a chest X-ray or CT scan to look for changes in your lungs that might indicate TB. If these imaging tests show signs of TB, or if you're coughing up phlegm, your doctor will probably ask for a sample of your sputum, which is the mucus you cough up from your lungs. This sample will be examined under a microscope to look for TB bacteria. It can also be used to culture the bacteria, which can help identify which antibiotics will be most effective for treatment. In some cases, especially if TB is suspected in parts of the body other than the lungs, a biopsy might be necessary. This involves taking a small sample of tissue from the affected area to test for TB bacteria. Treatment for tuberculosis. Once TB is diagnosed, treatment usually involves a combination of several antibiotics taken over a long period of time. And when I say long, I mean long. We're talking about 6 to 9 months for standard treatment of drug-susceptible TB. This lengthy treatment is necessary because TB bacteria grow very slowly and are very good at hiding from antibiotics. The standard treatment for TB typically involves 4 antibiotics: isoniazid, rifampin, ethambutol, and pyrazinamide. These are usually taken for the first 2 months, after which treatment often continues with just isoniazid and rifampin for another 4 months. However, the exact combination and duration of antibiotics can vary depending on the specific strain of TB and which parts of the body are affected. It's crucial to take all the medication exactly as prescribed, even if you start feeling better before the treatment is finished. Stopping too soon or skipping doses can lead to the development of drug-resistant TB, which is much harder to treat. Speaking of drug-resistant TB, this is a growing concern in the world of TB treatment. Some strains of TB have developed resistance to the standard antibiotics used to treat the disease. These strains are classified as multidrug-resistant TB or extensively drug-resistant TB. Treating these forms of TB is much more challenging, often requiring longer treatment periods with more toxic drugs and sometimes even surgery. In addition to antibiotics, treatment for TB often involves other supportive measures. These might include nutritional support to help combat weight loss, medication to manage symptoms like fever and pain, and in some cases, methods to help drain infected fluids from the lungs or other parts of the body. For people with latent TB infection, treatment might be recommended to prevent the development of active TB disease. This usually involves taking 1 or 2 antibiotics for several months. At the end, living with TB can be challenging, both physically and emotionally. The long duration of treatment can be tough to stick with, especially as you start feeling better. The disease can also carry a stigma in some communities, which can lead to social isolation. So, it's important for people with TB to have a strong support system and access to resources that can help them complete their treatment successfully. Now, we want to hear from you. Do you or someone you know have tuberculosis? What symptoms did you have? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.